Hi, this is Jeff Zeig, and I'm the founder and the director of the Milton Erickson Foundation, and I'm here in New York, where I've just completed a master class and bringing you another 5-minute tip for therapists. In this tip, I want to talk about the confusion technique. Now, this was something that Milton Erickson added to the literature, I think 1963 or 1964, in a paper about the confusion technique for resistant patients. When Erickson was using the confusion technique at that time in his life, it was an aggressive technique. It was a technique that was attacking the resistances. And that technique could be created by juxtaposing some opposites, like conscious and unconscious and understand. So at first, an aggressive technique, what I would call hard confusion. So you have a conscious mind and you have an unconscious mind. And your conscious mind has ways of understanding things that your unconscious mind may not understand. But the kind of conscious understandings that you unconsciously understand are different from the conscious understandings that you unconsciously understand. And then there are misunderstandings, and you can unconsciously misunderstand your conscious understandings, and you can consciously misunderstand your unconscious understandings. But the kind of conscious understandings that you unconsciously misunderstand are different from the unconscious understandings that you consciously understand. But you can't really understand until you take a deep breath, close your eyes, allow yourself to focus inside. So this was a method of creating massive destabilization, as if the person is floundering in a pool and then suddenly throwing them a life raft, something that they can grasp onto. So in the initial conception of the confusion technique, which Erickson could seemingly do endlessly, not just a short burst like I was doing now, but he could go on for quite a long time, creating this massive amount of confusion, which at first was meant to destabilize resistances. I can remember talking to Louis Wolberg, one of the great pioneers of medical hypnosis in the 20th century, and he was telling me about a technique that Erickson used when he was visiting New York. Wolberg was working with a patient who he thought that hypnosis would be relevant to help the patient achieve his goals, but he was unable to induce a trance. Erickson seemingly worked with the man for half a day and created massive confusion techniques until he was able to help the man to enter a light trance, confusing the man to his identity. The who you are is different from the who you can be, and the who you are for me is different from the who you are for you, and the who you need to be for you is different from the who you are. And Erickson continued this massive amount of confusion until he was able to create a trance state in the man. Now this morphed, and it's morphed its way into what could be called destabilization or soft confusion. It was a matter of controlling the level of tension in a hypnotic induction, also within therapy. So Erickson would say that confusion was a part of every induction, whether or not the operator realized it, because if you're asking somebody, for example, to do an arm levitation, but you're telling them that they're not going to feel as if they're lifting their own arm, there's some mystification in that, some destabilization in that. Now, when Erickson, in his later years, was using mild destabilization, soft confusion, for example, in a common induction that he would do talking about learning to write the letters of the alphabet, he might say, do you dot the T and cross the I? And this was just woven into the subtext to create a mild amount of tension. Now think about a musician, a composer, somebody who's creating music. They're not just going to create music using dulcet tones. There needs to be a combination of consonance and dissonance. And the dissonance needs to be inserted into the warp and woof of the composition, leading eventually to something that's consonant. Most people, when they're doing inductions of hypnosis, the induction is like a lullaby. The level of tension in the induction is lulling the person into trance. the trance can be created similar to a symphony, where these elements of dissonance, these elements of destabilization, these elements of soft confusion are woven into the fabric of the induction. So, as was the case of Erickson, oftentimes he started the induction by increasing the tension, using a little bit of destabilization, lowering the tension, building tension, lowering tension, creating an induction that was more similar to a symphony than it was a lullaby. You can read, there's an excellent article in one of Stephen Gilligan's book about the confusion technique. You can read Erickson's original article, and you can begin to orient yourself to how moments of destabilization can be used as ways of guiding experience more profoundly, about creating states that are more realizable by the client. This is Jeff Zeig with another 5-minute tip for therapists. Hi, this is Jeff Zeig. Here I am at the offices of the Milton Erickson Foundation in Phoenix, Arizona. But December 6 through 9, I'll be in San Francisco for the Brief Therapy Conference. I started the Brief Therapy Conference in 1988, I think, where we organized the first multidisciplinary conference that brought together practitioners of brief therapy to talk about state-of-the-art methods in helping people to get out of therapy as quickly as possible. There are many different schools of brief therapy: psychoanalytic schools of brief therapy, Gestalt schools of brief therapy, cognitive behavioral schools of brief therapy, systemic schools of brief therapy, and the idea was to bring together practitioners from different schools. Our focus in this brief therapy conference is especially about treating disorders of anxiety, depression, and trauma. We've had some of the great experts in the world, people like Bessel van der Kolk talking about trauma, people that are talking about how you can work with families when they are suffering from anxiety, depression, and trauma, experts on cognitive behavior therapy, solution-focused therapy. I really invite you to go to our website, brieftherapyconference.com. It's an embarrassment of riches, an incredible array of faculty who are state-of-the-art and presenting their latest methods of working with anxiety, depression, and trauma. We also have programs on multicultural therapy. We have a pre-conference day if you need ethics credits, if you want to learn about some of the essentials of hypnosis. We have a post-conference day in which Michael Yapko and I will do a master class on treating, where we actually do treatment of people in the particular style that we work on, and we're able to comment on each other. So I invite you December 6th through 9, San Francisco Bay Area, brieftherapyconference.com. Please join us. There are significant discounts for registering early. Thank you.